I think it's a very good platform to sharing the experience and challenges and lessons learned. And I think the conference is a good chance for us to make friends. And I think, of course, it's a very good conference, but also it likes a party, big party, because all the social workers, the NGO workers, has chance to talk, to happy, to enjoy our time. So I think it's good.
I have learned different models from different countries, from different organizations. So I have observed all the different best practice models, and I have good learning materials from here. And I would be happy to apply this kind of model in my country, and the best practice model from India, from Philippines, from Indonesia, Malaysia, Bangladesh, all of South Asia Pacific countries. So it's the best learning for me, and I would be happy if I wished I would be attending all the conference previously, all 6 conference. But this is, anyway, I'm very happy to be the part of this conference and share my experience and learn a lot from this conference.
This conference is mainly focusing about the reproductive health, and I'm from Department of Medical Research, so we are going to do an intervention study in our country. So we have learned a lot of good practices and lessons learned from other countries within the region.
As a young researcher, I have to learn a lot about here, research doing here, and their products here. And also I'm inspired about the youth sections, and also learn as it is reproductive health and sexual issues are discussed here. And in our country, I think topics like abortion and sexual health education. So I think we need to explore more. So I think here I can learn how they conduct research from the poster and also from paper presentation.
I learned much from this conference. Yesterday I attended a workshop to how to make comics, and I think this is interesting, and I can do it in Indonesia. And today I also involved the class that talking about male involvement, that I think this is a main problem also in Indonesia, so I can create some activities to do the same things.
In this conference, from the plenary session, from the satellite session, I have many experiences about the how to increase the youth participation in this issue, and how to make the consistency and the sustainability of youth participation to claim about the many issue and many things regarding to the SRHR issues. And the other things also about the youth rate in early marriage. So I concern also on this issue, and I will mainstream this issue in my faculty actually. So the dynamic of early marriage, or the root problem of the early marriage, is displayed a lot in this conference. So I'm so happy to be here.
Among our migrants, the problem is abortion, unintended or unwanted abortion, and lack of knowledge about the RH. They are a big-sized family. Therefore, I came to this conference to learn more about how to promote our communities to get more knowledge about reproductive health, especially for the young or adolescent reproductive health, and about the abortion.
It has been a great learning, listening to fellow youth advocates from other movements, or from civil society working on sexual and reproductive health, governments, and sharing some of my own experiences working with young people. And it's from so far what I have shared with others and what I have heard from others during the plenary and during the parallel sessions, it seems that during the last 20 years after ICPD, we have achieved a lot. There have been lots of achievements and progress, but still there are challenges that we need to achieve, especially in terms of young people's sexual and reproductive health and rights. So I think that there is still a lot in terms of what we need to do in order to make sure that governments fulfill their commitments to protect sexual and reproductive health and rights of young people.